Good evening and thank you for joining us for News Center Maine at 5. I'm Chris Costa.
And I'm Bailey Cornick. First tonight, the federal government is abandoning hundreds of millions of dollars in vaccine research. We have our Pearl Small in the studio to tell us more about how that could change and how Maine's health leaders are reacting. Hey, Pearl.
Hey, Bailey and Chris. This is part of Health Secretary Robert F. Kennedy Jr.'s aggressive anti-vaccine agenda. Yesterday, he announced the Federal Department of Health and Human Services would cut $500 million in vaccine contracts. These contracts are specific to mRNA-based vaccine research, which is behind the vaccines used for COVID, the bird flu, RSV, and more. During the pandemic, the U.S. CDC estimates within the first 10 months of the vaccine being launched, it saved more than 200,000 lives and prevented more than 1.5 million hospitalizations. However, RFK Jr. believes the science behind it is actually dangerous, saying it poses more risks than benefits and suggesting a move towards alternatives.
Right now, we're developing a universal vaccine at NIH, which is a vaccine that addresses the entire phylum of viruses. And so it's a vaccine that mimics natural immunity, and it is effective against any kind of mutation, so it doesn't drive the virus to mutate.
Several public health leaders have already sounded alarms on Kennedy's move. The Center for Infectious Disease Research and Policy also notes scientists have cautioned against a universal flu vaccine, saying it's not a new idea and has so far been a failure. Chris and Bailey?
All right, Pearl Small in the studio tonight. Thanks so
you.
much. Joining us live here in studio is Dr. Nirav Shah. You probably remember him, the former director of the Maine CDC and former deputy director of the U.S. CDC. Dr. Shah, thanks for joining us.
Thank you for having me.
Let's start with the basics for our viewers. They probably remember this term, mRNA vaccines from the COVID-19 pandemic. Can you help our viewers understand, if we kind of tap into the 5 years ago, what exactly does an mRNA vaccine do? How does it work?
Sure thing. Why these vaccines are important is that a traditional vaccine, the kinds that have been around for 50, 70 years, they work by taking a small piece of a virus or a bacteria and exposing your body to it, and then allowing your body's immune system to recognize that and build up its defenses. Why mRNA vaccines were such a game changer is that they didn't mess around with taking a piece of the bug. They actually just took a little bit of the genetic material and put that into the shot, and then allowed your body to make the protein that it would result from, and then make its own defenses against that. Now, the reason any of that matters, number one, it's a lot safer. Number two, if the virus you're dealing with changes, it's a lot easier to update the technology. And number three, for a lot of traditional vaccines, they rely on things like eggs to grow the virus. But mRNA vaccines don't need to mess with any of that. They can come straight out of a lab without relying on lots and lots of expensive, cumbersome technology. This was one of the unbridled successes of the first Trump administration, and Secretary Kennedy's decision to suspend the research, as we'll talk about, is definitely a wrong turn that leaves us less safe.
It's a good segue.
So you put out a thread of tweets this morning in response to this move. You called it a setback for public health. You kind of touched on this. Why do you feel this way?
You know, in a crisis, in a pandemic where we're dealing with infectious diseases, you want as many options on the table for potential ways out of that pandemic. You know, if we think about COVID, even though we ended up in the United States with 4 vaccines, there were dozens of early candidates, dozens of horses that were in the race, all vying to get over the finish line. And that's what you want in a crisis. You want all your bets on the table, and ultimately you'll let the scientific process figure out which one of those rises to the top. And that's the approach you should take in a pandemic. We shouldn't be narrowing the set of choices that we have. We should be looking to expand them. And so that's why suspending this program of 22 different vaccines that were under development, that's why ultimately it makes us less safe. Let me give you a concrete example. One of the bugs that I worry about is avian influenza. It's something that's been circulating, and it's got the potential to be the next pandemic. I don't know if it will be, but it's got the potential for that. And one of the contracts that Secretary Kennedy suspended and canceled was development by Moderna of a vaccine that would be ready to go in case we found ourselves in the midst of an avian flu outbreak. That's the sort of short-sighted thinking that leaves us less safe and less healthy, not more safe.
We were talking a second ago about how older vaccines would use a technology where they actually use a piece of the virus. Is that the whole virus vaccine that he's talking about?
That is part of it. And you're absolutely right, Chris. The Secretary, in his statement, embraced this technology called whole virus vaccines. And it's a perfectly viable technology. It is a little bit dated. And so I do wonder why we're doubling down on technology that's 50 years old rather than something that's also just as exciting and useful like mRNA technology. It's not that I think one is definitely better and one is definitely worse. It's that for me, when it comes to preparedness, I want as many horses running the race as possible. As I think about disasters and crises, my mantra for the U.S. government, for the state of Maine, is that I want us to be ready so we don't have to get ready when the crisis happens. And the best way to be ready is to have all the horses lined up and ready to run.
So then, lastly, and I think most importantly, do you have any insight as to why he would want to pull back contracts on these types of vaccines when we say all of the options should be on the table?
I'm somewhat at a loss. I can only go on what the Secretary has said in his video and in his documents. First, a decision like this should be accompanied by a full, robust scientific brief, and we haven't seen that. And that in and of itself is a loss and a foot fault on the part of the Secretary. But the Secretary said that he doesn't think this platform is safe. The evidence suggests otherwise. The data that we have suggests otherwise. Secretary has indicated he thinks other platforms are viable. That's great, but that doesn't mean we need to exclude others. So I think this is the wrong move, and I think it's one that leaves us less safe.
We've got a lot more to talk about. Dr. Shah is not going away. We're going to talk to him more coming up on News Center Maine at 6. Doctor, we'll talk to you then.
Thank you.
Thank you both.